Hi, my name is Derek Meyer. I'm a nursing student in the master's program at Kent State University and currently a nurse manager in the cardiovascular ICU. I'm a proponent of Ohio House Bill 286 and looking for support in upholding this bill in the hospital setting, specifically in the ICU. First of all, thank you to my Ohio State representatives for the opportunity to present on such an important matter. Ohio House Bill 286 was passed to improve the quality of care and life of the patients and family members through this service. The new law requires healthcare facilities to identify patients who could benefit from palliative care. At the state level in Ohio, my most trusted elected officials, we need your support to hold hospitals to a standard, enforcing Ohio Bill 286 and offering palliative care to the ICU patients that meet the criteria. In many cases, we're not seeing the service offered for the appropriate patients identified, and patients are missing out on the high quality of care they deserve. For example, a cancer study was conducted and only 62% of patients that met the palliative care criterion were consulted before death, and only 56% of those patients referred to palliative care during their ICU admission. Historically, palliative care is an interdisciplinary care, a team that optimizes physical, psychosocial, and spiritual symptoms of patients and families whose quality of life is impaired by serious life-limiting illness. There are specifically ECMO patients, CV-ICU, or cardiovascular ICU patients not being offered a palliative care and meet the general criteria for this service that involves not only the patient but the family as well. Literature shows that up to 75% of patients in the ICU setting experience distressful symptoms, 80% of those patients suffering from anxiety and depression. How many of these patients could have benefited from palliative care? How can the state of Ohio help with enforcing this legislation? First, I think some of the additional key stakeholders need to be identified, which includes our hospital leadership team across the state of Ohio and the Quality of Life Interdisciplinary Council, which was created under this bill and under Section 3701.36 of the revised code. It states that the department shall publish on its internet websites information on palliative care, including information on continuing education opportunities for healthcare professionals, information about palliative care delivery in patients' home and in primary, secondary, and tertiary environments. Best practices for palliative care delivery and consumer educational materials and referral information on palliative care, including hospice. The department may develop and implement other initiatives regarding palliative care and education as the department considers appropriate. By being in support of expanding the criterion or the patient seen and could benefit from palliative care, you can expect to see these results: fewer days in the ICU per patient, a decreased mortality rate, and lower operating costs across the board. Monitoring the success of offering palliative care services, hospitals need to make palliative care a key metric. Measuring success through education and standardizing the overall metric, showing the percentage of patients that met the criteria for palliative care and how many of them were consulted. At the very least, we need to expand education and training caregivers to provide palliative support in the inpatient ICU setting. We acknowledge that palliative care is being offered in the hospitals, but we are still seeing a significant gap in education and the need for a holistic approach to the patient's plan of care that palliative care supports. There will be limitations to this policy, and having enough palliative care physicians and resources support this significant growth and expansion of patients receiving palliative care will be challenging. But the data supports the need to continue enforcing facilities to support this expansion that will benefit and increase the overall quality of care for patients, reducing ICU costs and the ICU length of stay. Thank you all for your time in consideration and upholding and supporting the Ohio State Bill 286 and holding hospitals to a high standard.